Secretary Robert F. Kennedy Jr. reshapes the federal government's approach to vaccines, diseases, and medicine. Some Democratic governors are taking public health into their own hands. The leaders of 15 U.S. states and territories announcing yesterday a new Governors Public Health Alliance that will share data, coordinate policy, and prepare for future pandemics. Hopefully we don't get any. Joining us first this morning in a first on CNBC interview is one of the alliance's founding members, Colorado Governor Jared Polis. Governor, welcome back. It's good to see you again.
Good to be here.
Can you talk a bit about how this all came together?
You look, the federal government is withdrawing from the space of providing states and cities and counties and people the kind of scientific-backed advice that many people have always counted on. States do this to a certain extent. We have departments of public health, but there's a lot more capacity, and frankly, it's more efficient to do it together. So what we've got is about a third of the population of the country, I think 34% of the country, states that are represented here. So we're really exploring every avenue, like stockpiling equipment that we might need, researching with and being a liaison with international health entities, doing a lot of the kinds of things where there's a bigger and bigger question mark about the capacity of our federal government to empower people to stay safe and healthy.
So this goes beyond just protocols and recommendations.
It's not just about, I think in the lead-in you mentioned pandemic. We certainly hope there's not another one in our lifetime. It's about everyday infectious vectors. It's about new and novel treatments. It's about prevention. It's about science first. It's about how states can get a better economy of scale by pooling our resources. So we're ready for outbreaks. We hope that we can count on the federal government for more. Obviously, right now, they're shut down entirely. Even when they open, they'll be severely gutted at the CDC. And, of course, we want full transparency into what we can expect, for instance, for a national stockpile of whether it's vaccines or whether it's PPE, masks and gloves. But in the meantime, we know that we don't want to live with that uncertainty. And as state leaders, governors, it's our responsibility to be ready for whatever comes our way.
Governor, it feels like it's just confusing for consumers. You're putting together a patchwork of different recommendations on health advice and undermining the federal agencies when it comes to giving, really important advice on people's health.
Well, I don't think there's any advice that comes out of this. It's really about where we can gain better economies of scale and be ready. Information sharing, of course, again, from international health agencies, from our own health agencies, from state agencies. We don't need to replicate that work across these states. If there's great work that's done in a state around a new vector, we want to make sure that's disseminated. Can we rely on the federal government to disseminate it? I sure hope so. But when it comes to life and death issues, I don't want to hold my breath, just hoping that the federal government, especially during the shutdown, but even as it reopens, severely gutted, can successfully disseminate this information.
What have they cut that you need in terms of those resources?
Well, obviously, right now, they're shut down, to be clear. They have a very skeletal crew. Assuming they do reopen, they will be a severely diminished agency from what they were. We want full transparency into what capabilities they will have and won't have. But we know that there's some gaps there, and I think that states can fill those gaps more efficiently by working together rather than having to recreate it in all 50 states.
Does this all get funded with state revenue?
Currently, this is funded through a nonprofit. If there are things that states, for instance, if we're purchasing equipment together, there would be the potential to work through this entity to purchase that equipment and have a pool. Certainly things we're looking at, depending on what the federal government does with the stockpile and how much is available of various equipment. But the core essence of the organization is a nonprofit.
Would you expect a group of Republican state governors to, people try to game this out and argue that it's a line toward some eventual separation or secession in the country, some dissolution of the republic. Is that too extreme?
I don't think anybody's said that about this. It's about what states can do better together versus working on our own. Of course, we hope that there are more Republican governors and Republican-led states that join this effort. We also hope that the CDC and the federal capabilities remain strong, and then this organization will have less to do. But, we want to prepare for all eventualities. And, of course, seeing what we're seeing with the withering of the federal capabilities and the information flow to states and residents, of course, there's more that we can do together. In many ways, this is part of pushing things, responsibilities out to the states. And states can pick that up by working alone or working together.
But so it's not going to be advice, you said. You're not going to give vaccine recommendations or anything. You're not going to say anything that goes contra to what we're getting from the federal agencies. That's not what this is about, right?
Well, I'll give you an example. The federal government, for instance, put some barriers in the way of accessing the COVID vaccine. We in Colorado acted very quickly to say, you don't need to go to a doctor. You can just go to a pharmacy, a grocery store to do that. To do that, we had to do the legal background work to do that. That's the kind of shared resource for states that do want to, under federal guidelines, make vaccines more available for those who want them. We want to explore the best way for states to do that together, as well as, of course, the states that choose to do that independently.
Finally, Governor, while we're talking sort of states and governors, I wonder, there's been a lot of discussion about sending federal troops into states against their will, and remarkably how Oklahoma Governor Stitt sort of spoke out and said if this happened in a red state, people would lose their minds. Is any of that affecting the way governors relate to each other, either with their governors' associations or just your own personal dealings?
Yeah, I mean, if you want to understand how Democratic governors that are subject to federal troops are feeling, just imagine the shoe is on the other foot, which is what my colleague Governor Stitt alluded to. So if you're a Republican watching this, imagine it was President Biden sending troops into your Republican state to enforce DEI or some other notion that you have that President Biden supported. Just imagine for a moment how you would feel. That's very much how these Democratic governors feel that are under assail from federal troops invading their own cities. Look, the National Guard is critical. I've used them many times. I used them as recently as 3 or 4 weeks ago when we experienced fires in western Colorado. We may or may not need them for some floods we're currently experiencing. We use them regularly. They're absolutely key. For them to be taken away and federalized decreases public safety, and I think that's what these governors are saying.
Governor, a lot going on at the state level, that's for sure. We don't talk enough about it. Appreciate the guidance on this one. It's good to see you. Thanks for coming on. Governor Jared Polis, Colorado.